Good morning and welcome to all of you, whether here with us in this nice room in Castaigne or whether you are following us remotely. My name is Carmen Laplaza and I am the Head of Unit of Health Innovations and Ecosystems in the EU Research in the European Commission. Research on environment and health is a priority for us. Over the last 20 years, the European Union Framework Programme for Research and Innovation has funded over 2 billion euros through more than 500 multi-country research projects on the field of environment and health, supporting an extensive framework of policy initiatives in the field. One of the areas of this portfolio that has received increasing attention in the last years is the research around the impacts of climate change in our health. Climate change is an undeniable reality. The 2022 report of the Intergovernmental Panel on Climate Change predicts that global surface temperature will continue to increase, to rise in the coming years with the associated changes in the climate systems. So it is expected, unfortunately, that heat waves and extreme weather events will continue increasing their frequency. It is also a fact that climate change affects determinants of health, such as food and water security, and air quality, increasing the risk of transmission of vector-borne diseases, but also the incidence on different non-communicable diseases. There are many alarming factors. We can mention, for example, that over the past few years, heat wave exposure have achieved new highs, particularly affecting the elderly and vulnerable population. Premature death has also increased significantly in the last years. But even though there is this overwhelming evidence on the health impacts of climate change, countries are not delivering an adequate response proportionate to the risk their population are facing. So this scenario of climate crisis and the impact on our health calls for urgent action at global level. And that's why we wanted to discuss with you here today how, in this context of crisis, can current policy initiatives and also research efforts provide the necessary evidence, the necessary tools and frameworks to answer to this serious threat. And we are going to have a session today divided in two parts. First, in the first part, with our three panelists online, we will explore the European policy context that is triggering, that is requesting for research and innovation actions to understand, anticipate, and mitigate the consequences of climate change. And in the second part, we will explore the role of research, providing the evidence and the tools in order to help us fight. So I would really like to ask you to interact with us. Whether you are following us remotely, you can submit comments and questions through a Slido that you can find next to the stream on the conference platform. And for those who are here with us today in the room, you can, we will give you the floor to ask questions, and if you want to do it anonymously, we will, you can do it through slido.com using the keyword moon. And we have here with us Philippa White from the Young Forum of Castaigne that will help us with the Slido, summarizing the comments and questions. So with no more introduction, let me welcome our two first panelists. Good morning, Peter Loeffler, my colleague from the European Commission in DG Klima, and Alexandra Kazmierczak from the European Environmental Agency, who are going to provide us some information about the policy context at the European level. So Peter, Alexandra, the floor is with you.
Everyone in the room, let me just share my screen. Can you see that okay, Carmen?
Perfect.
Wonderful. Okay, well, thanks for having me. And I really would like to have, been with you in Castaigne, but this wasn't really an option. So I think you have to cope with me on the screen. I'm very pleased to you today, together with my colleague Alexander Kazmierczak from the European Environment Agency, the European Climate and Health Observatory. Now, when it comes to climate change, the first thing and a real priority is, of course, to prevent further climate change, i.e. to cut greenhouse gases. And here, the European Union is committed to become climate neutral by 2050, and we are committed to significant greenhouse gas emission cuts by 2030 already. And the point really is that doing this has a significant short-term to medium-term health co-benefits. The move to sort of a decarbonized economy and to a clean energy future will save us from a lot of morbidity and mortality, notably from air emissions or air pollution. Also, what comes to mind here, and if we talk about this aspect, is that the healthcare sector itself is a significant emitter of greenhouse gases, and there are important initiatives in the field. But for today's event and for the observatory, this is actually not really the aspect which we had in mind the most. Rather, it is the fact, and Carmen Laplace has said it already, that unfortunately a good degree of climate change is now unavoidable. And that we will see a persistent and continued strong warming throughout this century and beyond. And so since 2015 or so, we had a major of international reports, and I don't need to dwell a lot on this slide, Carmen already said it, with mounting evidence that climate change is a significant challenge and will have sort of significant negative impacts on our health and well-being, but also on the capacity of our health systems to address these challenges. And of course, the weather extremes which we had in the recent few years just real fueled this case, literally, and added the awareness. You know, we had record-breaking heat waves with the rise, actually, in heat-related mortality. We had floods and storms in Europe, which really killed people. And we had water quality problems. And I mean, I'm speaking of Europe here, you know, not of, you know, India, for example, where the heat wave really tested the limits of human survivability, or the devastating floods in Pakistan, which is a huge death toll. Now, all of this evidence and these events together meant there is sort of a rapid amount of a rapid development of policy at the international stage. Last year, we have seen the WHO Global Conference taking place alongside the COP26 event of the United Nations Framework Convention on Climate Change, with a focus on climate change and health, and a zero regrets paper on that particular issue. In the same year, the International Association of National Public Health Institutes issued their roadmap for action on climate, health, and change. We saw later in the year the launch of the Lancet Countdown in Europe. Looking beyond the big pond, the US Office of Climate Change and Health Equity opened. And this year, quite remarkably, under the German presidency, the G7 health ministers issued a communique which focused on three main health worries and challenges. And this paper mentioned sort of the climate health nexus alongside antimicrobial resistance and global pandemics. And so this really means that the climate health nexus has become a major concern in health policy and a real linchpin. And the same is true if you look at EU climate adaptation policy responses. We just had 12 days ago, the European Parliament issuing a resolution which demanded more decisive action on climate adaptation at the EU level, triggered again by the droughts, fires, and so on this year. And which mentioned a lot, which spoke a lot about health. We had, of course, the Horizon Europe Research Innovation Framework Program with a particular focus on climate in its health work programs, and we will hear a lot about that later. And again, we had the European Climate Law and the EU Adaptation Strategy last year issued. And the European Climate Law in its preamble speaks of the necessity to address the growing climate-related risks to health. because it was issued in the middle of last year, it already announced the launch of the European Climate and Health Observatory and the EU adaptation strategy, which in a way puts the duty to adapt of the climate law into action, preceded actually slightly the climate law. And so this adaptation strategy announced the launch of the European Climate and Health Observatory in the future. Actually, as a matter of fact, the Climate and Health Observatory was launched together with the strategy in March last year. And so this is now the perfect moment to hand over to my colleague Alexandra to present to you what the observatory is and does. Alexandra, floor is yours.
Thank you, Peter, and good morning, ladies and gentlemen. Many warm greetings from rather rainy Copenhagen. So indeed, the European Climate and Health Observatory was launched last year. In its physical shape, it's a portal containing information and knowledge about climate change risks to health and solutions, but it's much more than that. It's a partnership in the recognition that not a single organization holds the key to solve the issues of climate change risks to health, and we need to pull together our knowledge, our expertise, our stakeholder networks, our ways of communicating in order to make sure that there is a raised awareness of the risks and there is a raised awareness of the solutions that are available. Next slide, please. So I just wanted to very briefly introduce some of the contents of the observatory without really diving into details. But the first thing we are trying to do is to make sure that the climatic information about climate change risks to health is available and is usable for our stakeholders. So for example, the climatic data is presented not in an abstract grid, but at the national level, at the level of sub-national administrations, and is available to the non-technical users in this format. Next slide, please. Vulnerable groups have been already mentioned. Indeed, that's one of the foci of the observatory, to present how climate change affects the most vulnerable people in our society. So, for example, we draw on the knowledge developed by the colleagues from Lancet Countdown to present the changing and increasing vulnerability of the European population to heat. We also analyze the available data to look, for example, at the level of flood risks to hospitals across Europe. Next, please. We are also looking in a near term and trying to provide access to the existing early warnings or short-term forecasts. And here's an example of the UV index short-term forecast produced by the colleagues from the Copernicus Atmosphere Monitoring Service, showing the more immediate risks, so not just looking far into the future, but what may happen tomorrow or in a couple of days. Next, please. But the problems is only one part of the knowledge that is needed to resolve them. And we are also looking at the solutions that are available in the policy and practice. So this year we looked at the national policies of 38 European countries, and to what extent the adaptation policies and the national health strategies are looking at the climate change risks to human health, what measures are offered in those documents to address those. So in this way, we have a baseline of information where we stand collectively in Europe in addressing those risks and how far do we still have to go. Next slide, please. And finally, we are also looking at the case studies of implemented solutions, which really vary in nature, from case studies looking at how NGOs in Finland are addressing mental health to surveillance methods, resilience of individual healthcare facilities, actions to combat vectors of infectious diseases, greening of urban areas, and so on. So with this, I would like to close the presentation and really encourage you to ask any questions, but also to provide any comments. What should the observatory provide to you to be able to address the climate change risks to health better? And also, if you have any good case studies of implemented solutions that could be shared with others, I would also encourage you to share them either now or offline via the email address on the screen. Thank you very much.
Thank you.
Thanks a lot, Peter and Alexandra. And while our audience is thinking about how to answer to your question, Alexandra, we are going to give the floor to Alan Dangour, our third panelist, Director of Climate and Health from Wellcome Trust. We saw that this is a global endeavor, so interesting to see what is the strategy of Wellcome Trust in this area. So Alan, thanks for being with us this morning. The floor is with you.
Thank you very much, and warm greetings from London. I'm delighted to be part of today's meeting. For those of you that don't know, the Wellcome Trust is a large, financially and politically independent biomedical charity based in London, but supporting research around the world. We've been going since 1936, but over the last couple of years, we've had a major strategy rethink. And Wellcome Trust is now focused on 4 primary areas. Wellcome has always been a major supporter of discovery research, and that is to discover research that fundamentally changes our understanding of health, but is also now focused on 3 major global challenges, health challenges, and those are mental health, infectious diseases, and climate and health. And I'm very delighted to be the director of the climate and health challenge area. So what are we trying to do? Well, let me just, before I say that, let me just give you an idea of scale of the Wellcome Trust. After the Gates Foundation, Wellcome Trust is the 2nd largest research funder for biomedical research. And we have made a commitment to spend £16 billion over the next 10 years on our research endeavors. So in climate change and health, what are we trying to do? We have a mission to put health at the heart of climate change action. And I think this is where all of your support and help and research and efforts are so critically needed. There is a lot of talk about climate change. There is very little talk about the impacts on health of climate change. And clearly, as we've just heard from previous speakers, the climate crisis is a health crisis, and the impacts on health in Europe and around the world are going to be devastating. We have 4 goals in our strategy. The first 3 about the generation of new evidence, and that evidence, so to increase the availability, access, and use of evidence in 3 areas. Number 1 is the effects of climate change on health. How is health going to be affected by climate change? And we want that research to be at a national level so that national policymakers can understand what's happening now and what will continue to happen into the future under climate scenarios. The second goal is on mitigation. Of course, mitigation, as we've heard, is absolutely essential. The need to reduce greenhouse gas emissions and the potential for significant, substantial, and immediate benefits to health from rapid climate change mitigation. The third area is on adaptation. We're recognizing that, unfortunately, it's extremely unlikely that governments will meet their commitments, and therefore it's extremely unlikely that we will reduce greenhouse gases to the levels that are required. We must prepare our health systems and our societies for the significant impacts of climate change. So what are the adaptations that are needed to best protect the health of people in Europe and around the world? And our fourth goal is to build this field. And that is not only build the field of academics and researchers, but increase understanding amongst policymakers, increase understanding amongst other philanthropies, make sure that the impacts of health of climate change are on every single political agenda. We've heard just now that the German government brilliantly put climate change and health on the G7 agenda this year. I've been speaking already to the Japanese government to try to ensure that it remains on the G7 agenda for next year. We are trying to influence as broadly as possible political thinking on climate change and health. And that's what I really want to say. Our primary objective here is we are a research funder, but we are not, in our climate and health area, we're not interested just in funding research for its own sake, to keep academics employed. I'm a former academic, and I say this, so this hurts. We're not just trying to keep academics employed. We are trying to generate the evidence that will change policy. So in every case, we will be supporting research that has been thought about with policy in mind, either directly discussing with policy stakeholders, what are their needs? What are your policy needs? What evidence do you need in order to be able to shape a sensible evidence-based policy? Tell us that. Talk to researchers about what you need, and we will support that research. It is absolutely critical that the research that we support, and we will be supporting at substantial scale, and I'm very happy to tell you later about the sorts of things we're supporting. We'll be supporting at substantial scale the research that's needed, but it has to be linked to policy action. A very good example we've just seen in several of the slides is the Lancet Countdown, which is entirely funded by Wellcome, and we are already in advanced negotiations with the Lancet Countdown about the next phase. And that is a very strongly focused policy activity. That's generation of evidence for policy action. And that's exactly the sort of thing that we wish to continue. So I'm really delighted to be here, very happy to talk to you more about all of the work that we're doing. We're running out of time though, so I'll stop here, and thank you very much, and I'll hand back to the chair. Thank you.
Thanks a lot, Alan. I can tell you that your words are really sounding exactly in the same philosophy that from the perspective of Horizon Europe we have as well. We want really to fund the research that is going to be uptaken and represent a change with a positive impact in our societies and of course in this field of climate change as well. So we are absolutely in the same line of thought with you. So now I would like to give the floor to Philippa to see what the temperature is in the room, in the Slido room. Philippa, tell us a little bit. Is there any question, any comment that our audience wants to share with us?
Yeah, so it's pretty active Slido this morning. People are getting a lot of questions in already. So some of the points that have been raised so far is with the how much of an imminent crisis this is. People are asking whether member states are shifting from being reactive to being proactive, if there's still time to focus on mitigation, not just adaptation, and what the role of health systems can do in terms of adapting to become more resilient to the effects of climate change. And there have been some very interesting questions coming in. One for Alexandra and the Environment Agency, asking have they modelled the increase of diseases due to climate change, for example, allergic rhinitis due to pollen? And some others are asking about who exploits the Observatory's results and can they give any practical examples? Yeah, a few other questions as well, hopefully get time to answer.
Thanks a lot, Philippa. So, Alexandra, you were asking for questions. Here there are two specific questions for you. And of course, the other panelists can also intervene if they would like. But Alexandra, I give you the floor to answer to the two questions that Philippa mentioned.
Thank you. The question about the modeling of the increase of disease under climate change. In terms of the infectious diseases, we are working very closely with the European Centre for Disease Control and Prevention. And actually, they are able to provide us with reported data on incidence of diseases. So we are looking at this information at the moment. We are trying to developed sort of fact sheets for the 13 diseases that have been deemed by the colleagues from the ECDC and from Lancet Countdown as the most sensitive to climate change, also including the trends in the incidence. And we are at the moment analyzing with the colleagues from the Swiss Tropical and Public Hygiene Institute how the seasonality of the disease occurrence might be associated with the weather and climatic conditions. We also have in the observatory the modeling of the future climatic suitability for Aedes albopictus, for example, and a vector for dengue, Zika and chikungunya, as well as other diseases. So how the climatic suitability in Europe is likely to change. So we don't model the incidence of disease as such, but more focus on the climatic conditions, as well as looking at the trends that are there. In terms of the pollen and allergenicity, I can never say that, we are at the moment working again with the colleagues from the Lancet Countdown to analyze the trends in the pollen concentrations, as well as with then colleagues from Copernicus Atmosphere Monitoring Service, who are able to provide short-term forecasts. And yes, so if you have any good ideas how we could also take this work further, I would be very happy to hear that. In terms of who uses then results, we are working closely with the stakeholder networks of the respective organizations who are partners in the observatory. So in the EEA, we have networks focused on climate change adaptation, on environment and health. There are also the networks of ECDC and EFSA and WHO Europe through the Health in Climate Change working group, and so on. What we could see from the policy analysis this year, it seems that the climate change risks to health are much more covered in the national adaptation policies than in the national health strategies. So that sort of gave us a bit of an indication to shift our focus slightly, and our target audience being mainly those working in public health and the health sector, rather than preaching to the converted and talking to the adaptation community. So this has been a bit of a change in tag who we want to really engage and speak to, and we do that, for example, via the DG Santé EU health policy platform, which engages a number of stakeholders and professional associations from the field of public health and the health sector. So hopefully that helps.
Could I come in with a couple of points as well? On modelling climate-sensitive infectious diseases, we've just made £20 million worth of grants to some of the world's leading climate and infectious disease modelers to come up with different ways, different approaches to modelling this question, and globally, not just in Europe. Because we think there's a benefit in having a diversity of approaches and different teams working on these really important questions. So that's an area where we've focused a lot of attention this year already. And I think that the last point Alexander made is absolutely critical. Getting the health community to engage is absolutely essential. And we, this year, as last year, will be supporting a health pavilion at the COP meeting in Egypt. We'll be hopefully having a health day at the COP meeting in UAE next year, which we'll be supporting as well. So really putting health on the political agenda and putting it right in the center. And I've never been to this meeting before, the European Health Forum Gastein, so I'm delighted to be here. But I looked on the website, and it's quite interesting. Some of the text there is really pertinent to what we're discussing at the moment. So we must acknowledge the accomplishments in public health in the past. That's what it says on the website. But we need to build forward better. And we need to shoot for the moon, leaving business as usual firmly in the past. And I can't stress that enough. The future of public health is totally different from the past. And the future of public health will be entirely shaped by climate change. And we must recognize that and build our understanding of the problem, the scale, the burden of the problem, the scale of the problem, and the solutions that we need from the health sector to be able to respond. Thank you.
Thanks a lot, Alan. I fully agree with you of all the comments you made. It is really important to be absolutely conscious of the magnitude of the crisis we are facing here and how it's going to influence the work of our health sector. So now I would like to give the floor to the audience here. Is there anybody who would like to ask a question to one of our three panelists? Any hand raised? Not yet? Thank you. I see.
Well, whilst people are still pondering whether they should raise their hand or not, maybe just to quickly come in on the question, is it too late for mitigation? Yes and no. I think it's the short answer. Yes, it is too late. Climate change is a fact. It is happening, and we know it will continue throughout the century. Intergovernmental Panel on Climate Change, the IPCC, tells us only in the very optimistic, absolute best case scenario, we would actually be able to sort of stay below 2 degrees, the Paris goal. And we would sort of hit the 1.8 degrees mark, and then temperatures may eventually go down. But right now, I think we are rather, on a 3.2 degrees scenario by the end of the century, which is quite devastating. And this is sort of then, is it too late? No. Every effort on mitigation will pay off. Every degree of avoided warming will pay off in terms of avoided, in our case, morbidity and mortality, healthcare costs, but also many other disasters. I mean, we're not speaking just about healthcare here. On the question, are countries, too passive? Are they reactive or proactive enough? I think Alexandra and Alan both said a lot on that already. We see a lot of activity, as I really, it's been coming up in the last 2 years in particular. G7, a couple of EU member states, Finland, Netherlands, Germany, being very proactive, having health and climate strategies and all that. So there's a lot of policy making, strategizing. We get better evidence. There's a lot of efforts on modeling, monitoring, predictive power, and all that. But of course, when it comes to action on the ground, a lot has to be done. And I think both Alan and Alexandra said that, it should be a worry that adaptation policy says more about health-related risks than health policy in itself. So we still need to get this stronger in health policy. And there needs to be more action. Action in the sense of preparing the workforce, training people. This has been mentioned, education, training, capacity building. We need to get the health infrastructures in place. We have a new EU guidance on climate proofing of infrastructures. Hospitals need to be able to cope with heat waves and potentially, okay, they have emergency power, I understand that. But hospitals will be also hit by weather extremes, and actually few hospitals have sort of the technical facilities to cope with extreme heat waves right now. So there is a whole amount of things that need to be done, and where I think we aren't really prepared well yet. But this is actually not only in the health sector, but I think across the board. So adaptation is a process which just has started, and we need to get better and learn things rather quickly. Thanks.
Thanks a lot, Peter. Indeed, many different things to take into consideration. But there is a floor raised here, yes. A question.
Thanks a lot. Yes, so my name is Caroline Kostongs. I'm the director of EuroHealthNet, which is a European partnership to improve health and well-being. And my question indeed was on climate mitigation, because in terms of working together between the environmental sustainable sector and the health sector, we can also do a lot in terms of changing behaviors of people. I mean, we want people to use public transport, active travel, to get people out of their cars. We want people to eat less meat, more plant-based food. We want people to warm their houses so there's no mold and so on. So it's quite a lot to be done there, I think, where we can team up and work much better together. At the same time, also in the health sector, in terms of hospitals, to greening hospitals and reducing food waste. And there's a whole area, I think, where the health sector can also help to mitigate climate change. And my second question was about how to deal with the trade-offs. Because some of the climate mitigation measures will no doubt impact on vulnerable groups and people that are already suffering and will also suffer from the climate change measures that are bound to be taken, because we need quite a drastic change of our ways of living. And how do we make sure that the green transition is also a fair transition, and how are you looking at that? Yeah, thank you.
Could I come in with a quick plug? Do you mind?
Of course, Alan, go ahead.
I've been working on climate change mitigation and the healthcare benefits of climate change mitigation for more than 10 years. We wrote a series of papers in The Lancet in 2009 with Andy Haynes, Professor Sir Andy Haynes as the lead author. I'm now in a very fortunate, so there's lots of evidence, but we really struggled to get it taken up. And I think your point on behavior change, but also political will, is really critical there. So I'm now in the fortunate position to be able to fund at scale work on co-benefits of climate change mitigation, or the co-effects. There could be benefits, there could be disbenefits, of course, as you talked about trade-offs. And we currently have a live call. So for those of you that are interested in this area, anybody in the G7 can apply for research. So we're looking for research in G7 countries. But and so if you go to welcome.org and have a look under the climate change bit of the website, you'll see a call. We're looking for major efforts that address some of those questions. So using real policy examples, working with policymakers about the changes they want to see to generate the evidence on the potential benefits for health of those mitigation actions, to understand some of the social dynamics, the population dynamics that are required to ensure those changes, and the political economy of those policies. So a much more holistic approach to asking these critical questions. I find it astonishing that the evidence isn't used, but of course the barriers to the uptake of these policies are enormous. And so understanding those more social science aspects of why policies are taken up or not, and how to get them enacted is part of what we're trying to do. So sorry, Peter, back to you.
No, absolutely fine. And thanks for your question, Caroline. Maybe just to come back to you on your 3 points, mobility, people's behavior. Food came to my mind. Food is one of the sectors where we have a huge potential to become healthier, more environmentally friendly, and better for the climate. And here, of course, our excessive consumption of meat in the rich countries comes into the focus. It's quite interesting, actually, that, for example, in relation to food policy, and of course the Russian aggression against Ukraine has food also thrown into focus. There are interesting debates now about aren't we too much focusing on the supply side of things and of policies looking on the supply side, and what about the demand side and consumer demand and behavior? And I think what I see there's a bit of a shift in the direction which I think you hinted at in your question. So I think we shouldn't leave anything unexplored here. On the hospital sector, I said it before. The hospital sector, but the health sector overall is a big emitter. I think there's studies which saying if we were the health sector a country, it would be sort of the 5th biggest emitting country. I think, just to give you an idea of the size, so it's very significant. At the EU level, we don't have, however, a sort of a specific policy just addressing the hospital sector or the health sector as such. We focus really our attention at the EU level on the more sort of framework type policy. So that would, and not on specific economic sectors as such, maybe with the exception of mobility, which is a particularly difficult sector. And with not so much success, I'm afraid I have to say. But this is something where I think also national action makes a lot of sense, or also regional and local action. And thirdly, about trade-offs, absolutely. And I mean, the Green Deal, there is this leaving no one behind narrative to the Green Deal. It is absolutely important that the socioeconomic transition under the Green Deal is also buffered in social terms and doesn't come with negative side effects when it comes to social equity. We have, quite interestingly, there is development of a new global health policy at the level of the Commission, and I think health in all policies will be one of the overarching themes here, i.e. integrating health aspects in all policies. And for us in climate policy, that would again mean, focus on the co-benefits of making sort of Europe climate neutral, but also focus on things such as air pollution from biofuels. Some people say biofuels provide a way out. We know they are contaminating heavily, and this is exactly one of the trade-offs which we need to avoid. In adaptation policy, also one of the mainstays in the EU adaptation strategy is the systemic nature of adaptation, i.e., avoiding situations where you adapt for something and you make something else worse, which we call maladaptation. So we have principles such as do no significant harm and sort of systemic screening of adaptation policy to try and make sure that policies avoid negative sort of side effects as much as possible, or realize synergies as much as possible. But in reality, there will be maybe some trade-offs, but we need to minimize them. Thank you.
Thank you, Peter, and thank you, Alan. And indeed, many different things to think about the role of the healthcare systems. We talk a lot about the transformation of healthcare systems, and indeed, this transformation needs to be sustainable because indeed the responsibility as polluter is also quite impressive. So many things to do from different angles, but I propose now that we move to the second part of the session, that we look at the research side. And I think the question that was asked here, it was very relevant because I think there is a lot of behavior education. So it's important that in the research we are doing, that as we have said, myself but also the previous speakers, it's important to do a research that is going to have an impact, that it's going to provide results that will be used. It's important that our researchers are interacting with a lot of people, also with citizens, to help them understand how they can also protect themselves. We cannot just wait for others to protect us. I think we have to be, as we often said in the health field, the self-empowerment. I think it's important also in the context of how to protect us from climate change. So before giving the floor to research, let me just maybe launch a poll, a Slido poll, that it's going to be open for a while, and we would like to hear from you what, in your opinion, are the top 3 impacts of climate change in health, those that will require to be tackled in priority, those that are worrying you most. So I don't know whether we can see in the slide, whether they will be able to see the different choices. But anyway, let's move to the second part of our session. We have discussed the policy supporting framework, and one of the key points to make this framework effective is to have a robust body of knowledge and an adequate set of tools to support evidence-based initiatives and actions. So as a response to the increasing concern around climate change, in the first work program of Horizon Europe, in 2021, we launched a topic called the health impacts of climate change, costs and benefits of action and inaction. And today is a very important day because today here in Gastein, we are launching the work of an ambitious cluster of projects, 6 projects that are going to work together to maximize their collective impact. And I would like to invite the coordinator of those 6 projects to come with me here on the stage, because they are going to be talking with us for the next 40 minutes until the end of the session on what is the work they are going to do in order to help us fight and to fight against this climate crisis that, as Alan was saying, is a health crisis. So please come with us. So they are the representatives of these 6 projects that are going to be kicked off today. More than 100 research institutions representing more than 28 countries, and with a budget of 60 billion euros. So congratulations for you, not only for for being here representing 6 different projects tackling different considerations, different impacts of this climate change, but also having agreed to work together in order to maximize your collective impact. We know, we try to work more and more in clusters really to synergize and achieve more all together, but we know it's not that easy, so congratulations, and we are waiting a lot from these cluster of 6 projects. So let me start with Catherine Tone from the Barcelona Institute for Global Health, which is coordinating the Catalyze project that you can see on the slide. So Katerina, tell me, what can we expect, what can we all expect from this new cluster of projects on climate change and health?
Good morning. So you can hear me all right? Yeah. So the main aims of the cluster are to obviously optimize the synergies between the projects, to avoid overlaps, and really to amplify the impact of the individual projects. Through the cluster, we will develop a joint scientific strategy to identify the opportunities to add value to the individual projects, And that strategy will cover two broad themes that were included in the call, and these relate to climate change-induced environmental hazards and their impacts on health and ecosystems, and also the emergence and transmission of pathogens. So we see in the cluster the key areas for value add from the cluster related to novel indicators related to climate change and health, the development of early warning systems and predictive models, as well as tools for modeling the health impact of climate change hazards and cost-benefit analysis, as well as the development of novel databases and data infrastructures. So together, the projects through the cluster will have access to a very large, diverse, and impressive stakeholder network in terms of its breadth and depth. And this stakeholder network will be really important in terms of amplifying the societal impact of the research and innovation in the individual projects. So collectively, the very large EC investment, which you can see what was on the slide earlier, the diverse topics covered in the 6 projects and the disciplines involved, and the diversity of the types of beneficiaries involved in the 6 projects. I think together through the cluster will really create a focal reference point for policy on climate change and health at the EU level. Thank you.
Thanks a lot, Catherine. Very important what you say about networking, and that's why we invite to the audience here today and also to the audience online to engaging with you, because I think part of what these projects will do, and as also it was asked before by previous speakers, it's important that they know what the needs are. So interaction with them will be very, very important. Carla. Next question is for you, Carla Maya, from the Institute of Hygiene and Tropical Medicine, University Nova of Lisbon, who is coordinating the CLIMOS project. Maya, tell us what or which are the climate drivers that are expected to have the most relevant impact in our health?
Thank you. Good morning, everybody. So it's not only one climate driver, but it will be several. And in the project of our cluster, we'll address several climate and environmental drivers expected to most impact health. For instance, some projects like High Horizons will specifically investigate one key climate factor and how it affects the communities. So the project will quantify the effect of heat on the health of pregnant and postpartum women, infants and young children and health workers. On the other hand, some projects will investigate a range of climate and environmental drivers to better understand their effects on human and animal health, focusing, for instance, on specific environments, such as the case of the Blue Adapt project, who will investigate how future climate change and other changes in the environment will influence the survival and the genetic evolution of coastal pathogens, namely bacteria and virus, and how these changes in turn may impact the human health. Others, like the case of CLIMOS project that my institution will coordinate, will focus on vector-borne disease, specifically on sandfly-borne diseases, to develop early warning systems of preparedness to mitigate current and future impacts on climate and environmental change on human and animal health. Other projects will address environmental hazards related to climate change, as Catherine already mentioned. In the case of Catalyze, who will address how air pollution and greenhouse gas emissions will have an impact, and to assist the ecological and One Health preparedness, mitigation and adaptation. The effects of heat waves, heavy rain, falls, snowfall, seasonal droughts, UV radiation, ground level ozone, and how it affects the human health will also be evaluated and investigated by Trigger project. And finally, but not lastly, the ID Alert project will address the effects of warning temperatures, extreme weather events, and traffic corridors to develop early warning and response system for infectious disease and health individuals. Thank you.
Thanks a lot, Carla. So we are seeing the breadth of the areas that we will cover. Impact on infectious diseases, on non-communicable diseases, quite impressive. So looking forward for the first steps of the projects and results. So my next question is for Mark Neumann from the Basque Center for Climate Change, who is coordinating the Blue Adapt project. So Mark, tell us, what will be the spatial scale of this research, local, national, global, and also which sort of environments will you study through the cluster?
Thank you, Carmen. When we're working in climate change, we normally start with the climate change impacts coming from the climate models, and we normally start historically with the global model, and then we're all very familiar with the downscaling to the regional level, and with going into finer downscaling of the climate change impacts, or expected impacts. At the same time, we're becoming more aware also of the necessity of taking into account different scales when looking for how to adapt or how to mitigate. And especially we're coming to a recognition that for adaptation, it is central to be really aware of the local processes happening at local scale and at regional scale, and that also the relevant policymakers are at that scale. So that means to be interacting in these case studies as we are doing at all the different scales, and especially at the local scales. And it is quite interesting that both within projects but also across projects we are addressing a very big range of scales. And what I thought interesting at the beginning, I was thinking in local, regional, national, as you mentioned in the question. But we have projects, 2 projects that have a very strong focus at the individual person level. At the individual persons, at households, at communities. And this is really, really good to see that we're starting at that scale. And then we move more to the community, the local, regional, national scale. Mm-hmm. And the environments that we're looking at are also a very wide range of environments. So in our case of Blue Adapt, it's coastal, quite focused. But then we're moving through urban, peri-urban, rural environments as well. And the domains, although this is like a European-focused call, and most of the research is focused in the European domain, several projects are also looking at analogues or at similar problems across sub-Saharan Africa and Southeast Asia. So I think that's very interesting. And the opportunity of working in a cluster like this offers us possibility of learning more about these scale effects and how processes at local scale are embedded in processes at regional scale.
Thanks a lot, Mark, and thanks a lot also for helping us disseminate this concept of working in clusters of projects, which we are supporting more and more in the European Commission for the reasons that you mentioned, between others. So indeed, interesting, and thanks to point at the complexity of the file. So we need to understand globally, regionally, but you also have to find the correct and appropriate measures that are probably different at local level. So thanks to point at the importance of that. There is no one solution that fits all. Next, I would like to give the floor to Silvana Sabatino from the University of Bologna, who is coordinating the Trigger project. Silvana, so we have policymakers that are following us here in this session. Tell them which methods and tools the projects will develop in order to estimate, anticipate, and mitigate the health impacts of climate change. So which methods and tools will help them protect the populations?
Thank you for the question. For the question, this is an important question. First of all, before answering in detail, I would like to share with the audience that this is a presented situation to have the possibility to work with 6 consortium together with top-level scientists in many disciplines. So before saying that we will have a number of tools that I will detail in a moment, it is really important that the science is really at the basis of what we will produce. So each of the project will have a strength on climate, strength on medical investigation, on social components, on technology. So what we have brought in this project is the best we could and Europe could offer. So this is where we stand. I got to know my colleagues just a few months ago, and I had the opportunity to appreciate how we responded to this call. Each of us putting the best of the consortium to really deliver the top science that we can have. Having said this, what we will develop are web apps, but also we will improve the indicators, so we will contribute to the Lancet countdown the best we can. And as my colleague has just said, the scales of the problem are really at the base. So the models that we will integrate are really covering different spatial scales from days to decades. In fact, we don't only talk about prediction, meteorological prediction, but climate projections, but also climate predictions. So what we really wanted to do is to furnish to all the operators in the health sector with advanced tools that can have customized models. So early warning systems, we heard about this. We will apply also artificial intelligence, and every project will have customized tools that are embedded also in another aspect that we tried to cover. That is the difference in geographic setting. So because we cover experience from the Mediterranean up to the North Europe, so we need tools because our users will be the operators in the health sectors. For instance, in Trigger, we will work with emergency rooms, try to capture also while we go and we implement the project, how we can capture and we can equip them with tools that they can be prepared to deal with extreme weather, as we have detailed. So apart from the tools, and really I guarantee that there will be indicators and also models, etc., etc. The important message is that what we will do will be integrated between the projects, so that we could maximize the impact, as it was said at the beginning of the session. So thank you.
Thanks a lot, Silvana. I really liked your intervention and the importance of the science first, but also how you are really looking at very concrete outcomes that are going to help policymakers, but also healthcare professionals in order to finally protect our health from the climate change. And looking also at the different regions, settings, populations that require quite different ways of intervention. So thanks for that. Next question will be for Joachim. Joachim Rockloff from the Heidelberg University and Umeå University, who is coordinating the ID Alert project. So Joachim, tell us, how will the work of this cluster of projects answer to the policy priorities that were pointed at in the first part of the session? How your work will translate into better health outcomes, that it's at the end of the day what we want to achieve with the funding of these projects?
There is many mechanisms for how the projects and the clusters will feed into policy processes. One is an adaptation strategy, which was discussed with Observatory, where there's a critical need to actually understand pathways better. So we need research, we need data, and we need indicators. And indicators is very important because they could help us to monitor trends. They could help us to see how the development is going in different regions of Europe, countries and localities. They could also help us to understand whether adaptation works and what type of adaptation works, and that's also very important for the clusters to bring adaptation and evidence of effective adaptation to policymakers. Decision tools and so on. They could include nature-based solutions, but it could also include public health adaptation. There is additionally quite a bit of research on co-benefits in the clusters, which is also very important both for the mitigation and the transformation or transitions towards greener habitual behaviors and so on. Additionally, in the Horizon Europe policy, there's a lot of activities in terms of citizen engagement, stakeholder engagement, co-creation, co-design, co-implementation in the clusters, which is going to be really important, I think, in terms of capacity building along with policy implementation and policy uptake. And that's just a few things. Since being more specific, I think in all of these local context, it's very important to consider inequalities as well. So that's also something that the project and the clusters will actually address. And as well, looking at the local context and the different social, economic situations, it's important to think about translation of the insights from case studies, from localities, to actually upscaling to larger areas of the European Union and beyond for resilience and for preparedness. There's a number of more specific questions regarding the European Health Union and the EU for Health policies, which I think are maybe more related to some of the projects which look at zoonotic disease emergence and infectious diseases when it comes to preparedness. And I think and I hope the project will actually bridge the gap between the climate adaptation in terms of health and the preparedness communities, because it's a little bit siloed at the moment, but it's not two different things. It's actually, it has a lot of common denominators. So one important thing I think would be to actually bring that to the table and really bring evidence on climate change also being a preparedness issue in terms of zoonotic disease emergence. And there is strong connections in terms of environmental change, land use, which is also related to CO2 uptakes, and mammal or animal behaviors with species range shift. They also have to adapt, which is just intrinsically related to zoonotic disease and preparedness. And in the project, there is a lot of data collection as well, which is very much needed in terms of preparedness, in terms of better surveillance, in terms of better monitoring, related to apps and smart traps for mosquitoes, for example, with image recognition, as one example, which I think is going to be very important also for preparedness onwards. There is much more, of course, but that's a few of the things that the clusters will address.
Thanks a lot, Joachim. Indeed, there is a lot. Thanks for having pointed to also the important link with the preparedness. We know how important it is after the 2 years that we have lived. Indeed, the link is obvious. And thanks also for having pointed at the importance of considering appropriately the vulnerable populations that in particularly the most hit about this climate crisis. So now I will give the floor to Deborah Jackson from the London School of Hygiene and Tropical Medicine, who's coordinating the High Horizons project. So Deborah, tell us, How will the results of the work of the cluster be communicated to local authorities, to policymakers, to healthcare authorities, to the general population? And I would like to add, how can interested stakeholders engage with you in order to maximize the outreach of your work that, as we have here, is really very ambitious. So it is fair to try to maximize as much as possible. So tell us how they could.
Okay, great. Hi. Good morning, or good evening if you're watching from Asia. Basically, that question had a communication, and of course we'll use all the traditional communication forums, reports, policy briefs, presentations, all important peer review articles. But really the important part of that is, and which many of my colleagues have mentioned, is implementation action. It's about implementation. And so I'm an implementation scientist, so I'm really excited to represent this group because really all of these programs include quite a bit of the how. How do we do this in local contexts? And so I found that as I look through the projects and if we discuss them, 4 themes, which I think are helpful. Sorry, my little phone here. 4 themes which across all projects, and some of them have been mentioned, but starting with engagement. Engagement can, many people who say, oh, I did a report back to the community, or I did a policy brief. That's not what we're going to do. We're going to engage from the beginning. All of these projects are looking for working with stakeholders from the very start, and including even some fun things like citizen science, which ID Alert will use to make sure that we hear the local stories, the regional stories, the national stories, the global stories that we can use in our work to make things relevant to stakeholders and policymakers. The second, and I think Joaquin mentioned this one, was co-creation. All of the projects are using some element of co-creation to actually develop the indicators or tools, which I'm going to talk about in a minute, or some of the various responses for resilience. Once again, so that's like Trigger is going to use co-creation. But one of my favorites is the innovation slams from Blue Adapt, and other really fun ideas like that, other citizen, again, the citizen science. Also, as mentioned by Joaquin, indicators and monitoring. It's not just for us as the scientists, and I work a lot, of course, with WHO is one of our partners in High Horizons, global indicators, but indicators to know if mitigation, adaptation, if it's working, so that the local policymakers, the stakeholders, they need to monitor what they're doing. They have to see also many of the groups, including cost and cost effectiveness, so that we have to know, they want to know, is this actually, what are they getting for their money? So I think that's important. And the final one, and High Horizons, Climos are focusing on indicators. Finally is, and really this is the most important, Silvana mentioned tools. These are really tools for action. We want people to use the tools, and we want them to, and so that's why we have to start at the beginning with colleagues and users, in our case mothers, but a lot of the early warning system work. And it's really about making those tools useful, getting them out there, and then taking them to scale. So I just want to thank you all, and we look forward to engaging with all of you to co-create tools that we all can use to protect both climate and health.
Thanks a lot, Deborah. Very important things that you mentioned. Again, as you see, we are funding a research that we really want to be uptaken. So considerations like the local context, the co-creation, or the cost efficiency are very important, because we really need to ensure that all these fantastic tools that are going to be developed can be really uptaken and used by the policymakers. But now I would like to give the floor back to Philippa. Let's see what is the result of the poll.
Oh, the result of the poll. Apologies. So I don't know if that can be shared on screen.
why I also wanted.
Yeah.
Okay, so we have it here. So this is what worries most our audience, the three more important impacts: food security, water security, quite close one to each other, and heat stress. We have heard about the three in the work that you will do. Any specific thing that any of you would like to comment about these results? Any of you would like to say something about either food security, water security, or heat stress? I'm a bit surprised that about that result. Very interesting for us. I see Joachim wants to, and Deborah.
Okay, I think heat stress, obviously High Horizons is working on heat stress. And what I think is very interesting about heat stress is I tell people, oh, we're working in Africa. Everyone understands it's hot in Africa. But we're also working in Sweden. They're like, heat stress in Sweden? And, you know, I'm like, well, you know, obviously they're all set up for the cold, but as things get warmer, you know, it has to do with where you are adapted. A lot of the projects have adapt. And, you know, whereas, you know, that heat, as it gets warmer in Sweden, it's still warmer than they're used to and that they've adapted to. And so that they also need to look at mitigation and adaptation for heat. So it's important no matter where you are in the world, even if you're in what we think of as cold countries, and obviously, of course, in Africa.
Yeah, I just want to comment on that. I think this reflects a little bit what we know as well, and there's a lot of unknowns. I always think about impacts and knowledge in this area as we know the tip of the iceberg. There's so many complicated pathways and cascading effects of climate on health, which we have difficulties in actually describing. So I think one has to consider that when thinking about these impacts, that it's also a selection of the impact reflected in the evidence that we see. So, for example, as one example, which I think is pretty telling, is that there's very little research on zoonotic emergence, and I do have an interest in that. So I think that's quite important. There was a study a couple of months back which looked at species range shifts forced by climate change, and there was one of the few studies actually using climate change scenarios. It looked at how species and mammal species are going to change their distributions in 50 years from now, and also genetically what the likelihood would be that a virus spills over from one species to another, meaning you have a spillover process, and it actually concluded that, according to that model, there was a 4,000 times higher risk of these spillover events in highly populated areas. So that's a huge impact, which is very difficult to actually describe in terms of health. But when these events occur, it has very big impacts. So I think we should also, we shouldn't underestimate pathways that are more complicated in terms of health impacts and future health impacts.
Thanks, Joachim. Please.
Well, I'm just taking it back to the issue of scale again, because I think what would be probably quite interesting to see is, depending whom you ask this question, where you ask it, again, in which context, I would expect to get very different rankings. Also, with regard to the temporal scale, so are we talking about the current climate change impacts we're seeing now, or are we thinking 50 or 80 years ahead? We might also get very, very different rankings. And then, of course, all of these themselves are interconnected, and to get that better understanding of that interconnectedness is something that we aim to be working on as well through these projects.
Thank you. I would like, because I was thinking on what Joachim was saying about the unknown and what is still expecting us. And that made me think of what Alan had said at the beginning, that the public health of the future will not be the same as in the past. And at this point of our session, I would like to give the floor back to Alan, because I would like to have your opinion. You have heard the ambitions of this cluster of projects, and I would like to know, because you have your own supported projects and your strategy, I would like to hear from you how the work of these projects resonates with your own strategy and the work that will be funded by Wellcome Trust.
Yeah, thank you very much. And thank you to all of those who presented, and nice to hear some familiar faces. Unfortunately, we haven't been able to see any of the faces, but really nice to hear what's going to happen. I mean, I'm really excited by this, and I think it's a fantastic investment from the Horizon Europe program in climate and health. It couldn't have been more timely. I would like to fully support Joachim's final point there about the unknown unknowns. And in fact, in Wellcome, we will be doing some landscaping on some of those unknowns. So one of them will be on tipping points. Almost certainly, we haven't, we're looking to see what we can do on tipping points. But at the moment, we know that there are 15-something tipping points, all of which look horrific, but we don't know the impacts of those on health. So really, asking those questions that are incredibly hard to model, incredibly hard to ask, but we'll be doing that as well. We also know almost nothing, for example, on the impacts of climate on fungal disease, and there are some signals that fungal disease will become increasingly a greater problem for health as a result of increasing temperatures and changing environmental parameters. So there's a lot of unknowns that we know that at the moment. I mean, if I was to answer that Slido question, which also I was unable to do because of my background as the head of nutrition at the London School, I would have, of course, said food systems are one of the things we absolutely have to worry about. And food systems, particularly because of the way food is traded globally. And, we've talked about Europe a lot here, but actually these are massive problems for the whole world. And the impacts, of course, are going to be much greater in certain parts of the world where the warming will be greater, sub-Saharan Africa, South and Southeast Asia, Australia, South America, where there'll be huge issues with regards to the yields of the most important food crops that we consume. There is one. I'd just like to end with something. So it's a great set of projects, and I'm really excited to see how they develop. And I wonder whether we could set up a meeting in the future to hear more. And I know you've got one tomorrow or later today, in fact, which I hope one of our team will be attending. But there is one point as well, which I think it's worth reflecting on. In the past, funders have had a sort of scattergun approach to funding. Here's a call, let's fund some stuff. It's spread all over the world. No one talks to anyone, no one talks to the funder, and 5 years later you get a paper if you're lucky. That's not going to help us. So I think it's really, really excellent that in this case, as we are also doing now in Wellcome, we will be bringing together the grantees that we fund in a much more coherent manner so that we can ensure that there is that crosstalk, that learning, and that will speed up processes, open doors which otherwise wouldn't be opened, and benefit science and policy in many unknown ways. So I think that's an excellent thing, and fantastic for doing that as well. So thank you.
Thanks a lot, Alan, and a pity that you cannot say the faces. But nevertheless, absolutely crucial that we encourage our projects in general, in particular to these projects on climate change, to discuss and interact with other initiatives from other funders. It's really crucial. Now, I would like to give the floor to Philippa to see how Slido is moving, whether there are comments, questions that she would like to share with us.
Yeah, so it's continued to be extremely active. People have definitely had their coffee this morning, so I'll try and summarize quickly what has been raised. So people are asking a lot about the role of the private sector, that what it has to play in tackling the public health challenge of climate change and how companies have engaged with the Observatory, for example. There have been a lot of questions about the role of health systems, which have already been touched on. Should climate change and its effect on health be part of medical education? Is funding the answer to make health systems more resilient? And if not, what actions are needed? So people are asking about the role of leaders specifically, how health authorities and governments can build capacity and expertise in the area of climate change and health, and how can we encourage urgent leadership and political will in Europe in this area. There's also questions about what member states need to do in terms of implementing the key recommendations to achieve COP26 health programme commitments, and how they can raise the profile of health and climate change at the global level, at the UN and so on, and also the role of EU and not forgetting its responsibility to global projects and in developing countries. And there have been some very interesting comments about the health clusters. People are really excited to hear about them and find it very inspiring to hear about these real-world projects. Some interesting questions that have already been touched on just there in terms of how can you share the learning between the projects, and also another interesting question about if there's any country in particular that is leading the way in the field of climate change and health, and who are the pioneers and leaders in this field. Thanks.
Thank you. Wow. A lot of comments and questions. So maybe let's take the last one. Is there maybe, Peter and Alexandra know the answer. Is there any country who is leading? Who could be taken as the best practice and inspire the others? Because we see there is a lot to do.
Maybe just to kick off, and then Alexandra can come in. Yeah, many interesting questions. Leading country, well, I mentioned really sort of the German government and their role in the G7 minister communique, and my impression is that there is a good understanding of the strategic challenges. You know, we spoke about the systemic nature and how climate change is not just a health issue and cannot be dealt with in health, you know, in the health bubble alone. But we see the connections to food and to water and to biodiversity and all that. And there will be lots of surprises, you know, and there's a need for to venture more, I think, also into this disaster preparedness. You know, we have been setting up the Health Emergency Preparedness and Response Authority at the EU level. That already gives a bit of an indication of where we're heading to. But coming back to the question, so I think this is something which, in my view, the German health ministry, and they have set up a particular unit to deal with climate health, has understood, and they are poised really to establish some international collaboration and to reach out to other countries to get this process going. In fact, there will be sort of a follow-up meeting after the minister communique soon. And so that is, in terms of strategizing, really one of the countries which at the European level sticks out. But as I mentioned before, I mean, I'm aware of interesting and very solid work in Finland, for example, in the Netherlands, in France, and there is this cooperation between the national public health institutes, which is getting stronger. So yeah, this is, I think, sort of the panorama as far as I can see it right now. But maybe Alexandra can sort of complement that. Alexandra, I don't know.
Yeah, Peter, I think I can echo what you've been saying, and there's a lot of good practices in different countries, from setting up new government structures or governance structures, like in Germany, or like having a specific action plan for climate change in the health and social care sector, like in Finland, hosting the Secretariat for the International Association for National Public Health Institutes, and being quite active in France. I think France is one of the few countries which is really putting a lot of emphasis on monitoring mortality associated with heat waves, for example. So keeping a tab on that, and that allows them to monitor the effectiveness of solutions implemented. So I think that there is a lot that the countries are doing, and I really would like for the observatory to really become the sort of the vehicle for knowledge sharing and sharing the best practices and sharing what works among the countries on addressing the risks of climate change to health.
Thank you, Alexandra. And yes, indeed, there is also a lot to do in order to show the impacts, because the Lancet Countdown is doing an incredible work there, but there is still a lot more to know about exactly the impacts, not only in Europe, but all over the world. And I think there is a lot still activity to be done also in the measuring in order to convince that this is the real magnitude of this problem. I don't know if our speakers, our representatives from the projects want to say something following the comments that Philippa mentioned.
Sure, just to respond, I think this is working. There was a question about leadership, and I think particularly given the context of this meeting, it's a health forum. I think there's a huge I think room for leadership among health authorities and in the health community to really be very visible advocates for more ambitious climate action. And I think it's a very engaged community. This is one of the, I guess, reasons for the climate, for the Lancet Countdown for Health and Climate Change to really target the health community, because there's so much potential there for leadership. So I think that's a really important message for this meeting, and also I think is addressed across the projects. For example, in the Catalyze project, we are looking at several case studies around reducing the carbon footprint of health systems in Europe, and then also working through training health professionals, so health authorities and people in sort of leadership positions in health on mitigation and adaptation in the health systems. So I think there's, when we talk about leadership, that can't be emphasized enough.
Thank you, Catherine. You mentioned the impact of the healthcare systems also in and their responsibility, and I think this is, fully agree with you, this is an area where we have to do more. But I think Silvana wanted also to say something.
Yeah, I would like to add one dimension that was already mentioned earlier, that with this project we are not, we don't have a cathedratic approach, as Alan was saying. So the case studies that we have set up across the 6 projects are really based on co-design. And in fact, we try to reach different sectors of the population, from the infants to the pregnant women, passing by the workers. And the idea is that we link at a category of workers that are exposed directly, for instance, to extreme weather, rather than differentiating between different typology of work. So the important thing is that we need to diversify also the typology of the investigation in order to form and to equip the health sectors, policymakers, with enough information to customize the tools that we have to be prepared to climate change. So this is a really great opportunity to really give the voice to the citizens and participate with the scientists into the co-design of the tools and the experience, and be part of the knowledge path between, knowledge paths that allow us to understand better what is climate change and health, because we need a bit more understanding on this level. Yeah.
Thanks a lot, Silvana. Very wise words. I think that it's very important that we understand, and that we also, as citizens and citizens in general, are really empowered in order to fight as well. I mean, we also have to make face to face this situation. But I see that time is really going on very, very fast, and I would really like at this stage to give the floor here to our audience here in Gastein. Is there any question you would like to ask any of you? I see one hand raised, please.
Thank you so much. Francesco Florindi, Thermo Fisher Scientific. Awesome conversation. One thing that I haven't heard is, industry, and what is your expectations for industry in this project? We're trying to, meet the target at 2030, 2050. So we have a role there to play in terms of, our own emissions, our own contributions to the climate change. I'm more curious about the role of industry as a technology provider, as a supporter to help you to create the next solutions. What would you like us to work on, what the fields that you need innovation the most, and in general, what could be the role the industry plays? Thanks.
Thank you. Thanks a lot for the question. The role of the private sector had also been raised in the slide. So who wants to answer to this question? Great, Deborah.
That's one answer, I think, and yeah, she mentioned the role of private sector and industry. Private sector healthcare, they obviously run hospitals and systems, and so the work that these groups are doing on mitigation, and that private health facilities and private hospitals need to also take up mitigation efforts, and then also worry about the adaptation to protect their workers and their clients. And so I think that's one place that we do. Depending on the system, we might be working with government facilities in Africa, but how much of Africa also has private healthcare as really the providers. And so from that aspect, we need them to do that. But we also need to think beyond mitigation of, for example, medical supplies and waste and all of that. That also needs to be addressed in the private sector. So hopefully we can provide some information on that.
Please, Joachim.
Take yours. Yeah, so just a reflection on that as well. I think there's a lot of upscaling necessary. I don't know if it's really in this phase of our cluster projects, but at some phase I think there's a lot of need for upscaling of, for example, technological solutions like the smart traps that we are aiming to develop. That said, I also think it's a very complicated issue to work with industry sometimes because of greenwashing, and because of sometimes there is not always, goodwill in the transformation. It's also opportunistic, and that sort of borderline I think is very important to maybe together or in some way to sort out, like how can we work together. It's very important that we are on the same boat, but it's also very important in looking at history in tobacco industry and oil industry that we as scientists are also credible and not suffer from issues like greenwashing.
Thanks a lot, and I'm really sorry because I would really have loved to continue the discussion, but we have to stop here. We are running out of time. I would like to finish with one word or one sentence, which is that the climate crisis is a health crisis, and we really need to accelerate the adaptation. So we really need to engage different actors, different stakeholders, all levels, and really face together this important threat. So I would just like to thank you, our panelists. A pity that you were not here with us today, but there will be plenty of opportunities. Thanks to the three of you. I would like to thank you, our 6 coordinators of the cluster. Great that you are launching and kicking off the cluster today. And to our audience here in the room and also remotely. Thanks a lot. And please continue interacting in the future. These 6 projects need to know what you are expecting and what are your needs, what do you need from them to ensure that they will maximize the impact that we want them to achieve. Thanks a lot.